Um, I just want to say thank you, first of all, for having the swallow study video on our homework this week. I think I rewatched it like 5 or 6 times because it was so fascinating to watch. So, with that being said, this is the swallowing maneuver video, and yeah, let's begin. So first, we have to pay attention to um, the patient's posture. Making sure that the patient has correct posture is very important in swallowing therapy. If the patient is slouching or hunched over, that could cause choking, aspiration, or other things of that sort. So having the patient sit upright with their back and head straight will assist the patient in effectively completing each stage of that swallow. So, first I'm going to start with let me back up a step. I'm just going to use water instead of food. I hope that's okay, but I just figured I'll stick with the drink. So, okay, back to this. The supraglottic swallow should be used on patients who are able to understand the flow of verbal commands without much difficulty. Directing the patients to take, I'm going to explain it and then I'll demonstrate it just because it's too hard to do both. So at first, I'm going to direct the patient to take a deep breath and hold. And then after that, I'm going to have the patient continue to hold their breath and then swallow. And then from as soon as they're done with that swallow, I'm going to have them cough, which just is protecting the airway by doing that, and that will complete the corrective swallow. So I'm going to hold my breath. So here we go. Okay, the supraglottic swallow is a technique that closes the entrance of the airway at the level of the arytenoid cartilages. The patient follows the same procedure as what I just did, but the patient bears down while holding his breath to protect the airway, again, to create an effective swallow. So, same thing here. I'm just going to bear down. So, effortful swallow. I will first direct the patient to squeeze hard with all of their might when using their muscles in order to swallow, protecting the airway, creating an effective swallow. So all it is, sorry, I hope you can see. The next one, the Mendelssohn maneuver. What I'm going to do here is direct the patient to swallow saliva several times, asking him or her to pay attention to the Adam's apple moving upward upon a swallow, even paying attention to the up and downward movement as that's occurring. So once the patient has established the awareness of his or her Adam's apple, I'm gonna direct the patient to hold their Adam's apple up and hold it there for a couple seconds and don't let it drop until I say, just because this will allow for a safe swallow. So first, we just swallow the saliva a couple times, and now I'm going to do this. And let it go. The next one, the chin tuck. This one, I will direct the patient. And I can use cards too, which you talked about in your videos, but I'm going to direct the patient to move their chin to their chest just prior to the swallow and hold it in that same position as the swallowing event occurs. This has the advantage of increasing the pressure on the bolus and restricting the opening of the laryngeal inlet during swallowing, reducing the risk of laryngeal penetration and aspiration. So, what I'm going to do and swallow. Okay, on to the next. The head turn. I'm going to say that my right side will be my weak side and my left side will be my strong side just for this and the next one. So direct the patient to turn or rotate their head to their weak side during a swallow. The head turn to the weak side is postural change that may assist in the bolus flow down the intact side by obstructing the weak side, which prevents aspiration. And this is used on patients with unilateral paralysis of the pharynx alone. So, I'm just going to do this. And turn. On to the next. The head tilt is pretty much the same thing, but it's directed towards the stronger side. And then this just directs the bolus to the most intact side, usually appropriate for problems caused by unilateral oral weakness or unilateral oral and pharyngeal weakness on the same side. So, yes, and turn. I believe I hit all of them, so that is for the swallowing maneuver video.